We are asking again, what's the situation of clinicians in Ukraine and what can we do to help them? You're listening to Clinical Conversations. I'm Joe Elia, and I'm joined by my co-host, Dr. Ali Raja, an emergency physician from Mass General Hospital and Harvard Medical School. Our guests include Dr. Natalia Shevchuk, who is the chief narcologist of the Donetsk region in eastern Ukraine. Anna Matalyuk, the coordinator of a program with Yale School of Medicine called Expanding Medication Assisted Therapies in Ukraine. She works for the Alliance for Public Health based in Kyiv, and she's actually speaking to us from the Republic of Moldova. And we want to thank Dr. Frederick Altes, professor of medicine and public health at Yale, the program's principal investigator, for connecting us with the people in Ukraine. Our translator is Oleg Lutsenko.
Welcome, all of you. We really appreciate you agreeing to talk to us. We will keep this short. To all of our listeners, please, how are you doing there in the Donetsk region?
Well, now in the Donetsk region, so from today, so from 1800, so we have really, so we've dimmed our lights inside, so in the apartment, so we put out the lights, and really from 6 p.m. until 6 a.m., so curfew, so and we're not supposed really to put on the lights, so in any rooms in the apartment, so we are under shelling, so the sirens blaring, and we got really good down to the bomb shelter whenever it is available. So in just my block of flats there is a bomb shelter, and I try really to go down there, but sometimes I'm really sick and tired of it, and I really stay back at home, but it is something that you must do. Some people don't have bomb shelters, and that is why the people really are flocking from the other houses, from the other homes into this bomb shelter, running a high risk. So from time to time we are off to work because we have really 7 substitution therapy sites working in various towns in the Donetsk region, and to best of our luck, until the warfare had started, so we had enough really shipment of the medication coming into our region, so we just were guided by instinct. So we approached the distributor, so asking them really for an ad hoc shipment of the medication, and thank God we have it really. It is now sitting in the warehouse in Kramatorsk town and in the other towns of the Donetsk region, so we had really shipments during the hostilities, during the warfare. So, but now all of the towns have enough stock of medications, all the health facilities, so have enough really stock to see them through 2 months or 2 months and a half. And so in this regard, so we are doing pretty good. So, but we can't say the same thing about the other regions in Ukraine, just because we are in a very high exposure to very active warfare. We do not have any other refugees from the other state-run or private addiction sites. That is why we don't have any burden to bear. So, and I think that we will have enough of our medication to see us through another 4 months. So, if you are not bombed out, of course, and if you are not occupied, and if you are not squandered and plundered, so we have 612 patients in the substitution therapy. This is really for the whole of the region, wise in the Donetsk region, and just 2 people have migrated. One really traveled to Germany, and we haven't heard from him, and someone else to Lviv. Everyone else back here. So that means everyone really take away home dose. And we dispense medications, so depending on each specifics in each town, but at least really for 10 days in a row, and really the longest time, really 20-25 days, take away home dose to see them through. And we tried really to detail a group of clinicians, so as not really to report to the office every day. So for instance, twice a week or 3 times a week, so a clinician on duty in the the office to dispense medications, and we have really temporary detention facilities here as well. So before the war had started, so we really brought along those inmates every day to the health facilities, and now we really we dispensed a lump amount of this medication to them, so to facilitate dispensing. So to the 5 people there in the temporary detention facilities. So, and now we've been faced with a challenge with when the clinicians really are trying to flee from our region, and we are looking for their replacement. And as of now, the substitution therapy scheme in this Donetsk region is ongoing. So, and in this Donetsk region, it is more or less quiet and calm, and we have enough groceries in the stores, and we're getting our salary fine with that. And what else? And
well,
some also comorbidity and concomitant diseases, and all of them really to a full extent really have their access to antiretroviral therapy, and they also get their TB medications dispensed to them in the TB clinics as well.
According to the Lancet, Dr. Shevchuk, the treatment for substance use disorders stopped in that region, in the occupied region, back in 2014. Did you have many patients migrating from the occupied zone to your zone?
Yes, indeed. So we were in the project to facilitate patients' transfer from Donetsk, Holovka, and Makiivka. Those are the towns really in the breakaway regions from Ukraine under Russia's control. And we ended up having as many as 70 patients. So they traveled here and they got their housing, and someone rented their flats, and they were given some subsistence allowance, so as really to facilitate them really to settle in. All of them were just received, and so a few of them really came back there, just really 2 people, just because of some family challenges, so they had to leave. But other than that, everyone really is staying here, and we are kind of developing very close relationships. And now the situation is really busting out here, so with this active warfare waged against us. And in 2014, so we had for 2 months and a half the occupation, but the substitution therapy was ongoing, and after liberation, so the frontier, the borderline, so was moved further afield, and we found ourselves back in the Ukrainian territory, and the substitution therapy over the border, so just didn't stop overnight, but it just was nipped in the bud. So it just really persisted for 8 months, and then it stopped. So really they were on the mercy of the remaining supply of the stock of their medications, and then the other ones really traveled here. So from the other regions of Ukraine, so those patients really tried to migrate to our place, so it's really to stay closer to the borderline, so it's really to have more frequent meetings with their next of kin.
Dr. Shevchuk, you mentioned that your patients in the Donetsk region are, thanks to your care and your preparation, they're doing okay in terms of medication availability. But what about the other patients, everybody fleeing the Ukraine right now? Have there been efforts to get them seen, for instance, in Poland or Moldova or somewhere else to continue their care?
You know, our patients so didn't leave here. Just one of them really left for Germany, but he never sought clinical advice, so he was escorted by his relatives, by his family, so it managed really to get him any type of care. So, but he never referred to our care. Thanks very much to the Public Health Alliance. Thanks very much to the focal points on the ground, and the NGOs are very much involved in this escorting activity, but thank God we do not have this active active warfare going on here, and we don't have very many people willing to migrate. And we are pleased to find out that the regions that have the influx of those people migrating from easternmost Ukraine, so they are faced with really the stockouts of those medications, and that is why the people fear that they might be denied access to their medications just because of stockouts, or so they don't have enough. And
okay, you had a colleague in Mariupol that you have lost contact with. Have you heard anything further from that region?
Well, for the town of Mariupol, it was really the drug addiction clinic, very large one, and Alexander Pienko was the regional substitution therapy focal point for the Donetsk region. And actually, the last time that I kept in touch with him, communicated with him, was on the 1st of March. So there was very heavy bombardment and shelling, and after the 1st of March, neither with him nor with the other colleagues from that famous really drug addiction clinic. So I never managed really to get in touch with, nor by WhatsApp, nor via Viber. None of them really showed up really in the network. All of the cellular phones really switched off, and I'm trying really to get some tidings around the place about him or his colleagues, but I never succeeded there, unfortunately. So, and let alone, I'm really scared really to think what's going on there, so in that place.
While you mentioned that you have enough medication to care for your patients, we can't imagine what the morale of your patients and staff is in these circumstances. Are people able to get enough food and sleep? Is electricity at the clinics, is it stable?
No, I can't say really that we've got enough of all the stuff really to accommodate their needs, actually. So during this day, so I've been 2 times down in the bomb shelter. Sometimes I have really to spend overnight in the bomb shelter. So these 2 days, so the overnight was pretty much quiet, and the sirens were so were blaring not for a long time. So sometimes during the night, so you have really to spend the whole night down in the bomb shelter. So these 2 days, so we deem more or less quiet, and still so far as really the availability as groceries in the stores. So actually the staple foods are available. I can't really compare really the groceries and its assortment now out in the shops as compared to the pre-war times. So but I can't say either that we are starving. So we've got groceries in place, but it's all kind of subsistence level. So whatever you need fast.
I was looking at the statistics of COVID-19 in Ukraine, and it seemed that you were at a peak just as the invasion began. How are people doing with COVID-19 now?
People do get sick and come down with COVID-19, but we don't have really the surge of patients with COVID-19 as it was before the war. So we have a lot of really nationals from Kramatorsk and from elsewhere who have migrated, who have left. And actually it was really the mothers with children really who have traveled out, and it was really the hotbed of coronavirus transmission. And we ended up having fewer population here in place, and I think a good half have left, and people do get sick with COVID-19, but so we have less people really clustering together, and less mothers around, and more people really sitting back at homes, and somehow it must have really brought down so this COVID-19 incidence, and perhaps the people must be very resilient, because access to the medications in pharmacies are hard to get too, because their personal income going down and everyone is trying really to care for themselves. So it's not really to come down with this disease. Public transportation here. So if the municipal shuttle buses and the trolley buses were overcrowded, so previously now we keep walking on foot. And sometimes so we have really social bus service, and people now are keeping fit, are keeping more fit because of the coronavirus exposure.
We've covered a lot of ground so far, but is there something else that you would like to say to our audience? How might the clinicians listening to this podcast, how might they help you?
Do you mean what type of assistance, what type of help? So you can get us. So I think we'll appreciate some tips. So what it takes really to behave in such crisis situations, just because, so both the patients and the health providers alike, so not only the clinicians, but also the medium tier personnel such as nurses and all the other support staff working for the health facilities right now are nervous, and really they are now scared and frightened, and we are, so it's easy, so people are short-tempered, so because so a lot of people concentrating on the OAT side, so the substitution therapy side, so a lot of people really coming in, and some people really come in, so because of the because they don't longer have enough stock of their medication. Some people really come in drunk, and those are nervous breakdowns happening in the office at work, and so the health providers really push the security buttons every now and then. So it's really to bring in the security guards to calm them down, and we are trying really to talk, to communicate to the patients that they must not behave like this. And once again, so you have really their family coming in to escort the patients to the side. So it's not really to have that patient along the way. So it's not really to have someone really coming to the patient really to snatch that medication from them on the way. And so we have really to do a lot of communications that we have enough stock, and then we will have more shipment coming in. So don't be worried. And what do they dream about, the patients? So this is a secret. They dream about a humanitarian aid coming in, as in our heyday, and Canadian-made methadone and methadone, so from Germany. It is their dream, and I just share their concerns about it to you.
Well, Dr. Shevchuk, I want to thank you for being with us today from the Donetsk region. I hope many of us today listened to your President Zelensky talk to a joint session of the United States Congress. He gave an excellent speech. And we hope this interview will bring help where it's needed. And we applaud you and your staff. And we thank Anna and Oleg for their role in bringing us together with you today.
So a big thank you to you, so that you've heard us out and you're interested really to find out about our challenges. And well, I think it is very highly appreciated, especially if the people from far off really take our problems close to heart. And I will share this message with my colleagues so that we had this lovely conversation and it will make them happy too.
Well, let me just say that was our 286th clinical conversation. It comes to you from the NEJM group and the writers and editors of NEJM Journal Watch. The executive producer is Kristen Kelly. I'm Joe Elia.
And I'm Ali Raja. Thanks for listening, and more importantly, doing what you can to help these brave clinicians.